Hi, I'm Mark Shepherd, acupuncturist in Donington, Judicial, West Sussex. As you know, I've been talking to some practitioners around the world, and it's my great pleasure today to be talking to RJ Singer, all the way in the beautiful Byron Bay, Australia. How are you doing, RJ?
Yeah, very good. Thanks for having me, Mark.
It's a real pleasure. And RJ is not just an acupuncturist, but also a herbalist. He's a feng shui consultant. He's also a qigong therapist. And in talking to RJ, I've learned that he has a specialist interest in treating ulcerative colitis, IBS, Crohn's, and autoimmune conditions. So it'd be really great to hear about your experiences and how you actually got into that.
Yeah. Well, I suffered with it myself, and that's how I got into Chinese medicine. So in around age of 23, I started having pain in my gut and feeling of constipation, and my stools started looking weird, and all of a sudden there was blood in the toilet, and I was like, "Oh boy, it couldn't be good." And I was young. I was like, maybe I'm drinking too much. I got to stop drinking, and I quit drinking for a few months, and still saw blood in the toilet, and it was getting worse and worse and worse. And then I finally went and saw a allopathic doctor, Western doctor, at a hospital, and they had me do a bunch of stool tests looking for parasites and all the standard protocols. And then they're like, "Look, we think you probably have ulcerative colitis," which I'd never heard of before in my life. And I was like, "What does that mean?" Like, "Oh, it's ulceration in the lower part of the colon, and it affects the endothelium, the most outer layer of the large intestine. But we don't know for sure until we do either a flexible sigmoidoscopy or a colonoscopy." And I wasn't really interested in that. I just kind of ignored it, and I said, "You're going to have to take this medication for the rest of your life." And I was like, "Yeah, whatever." So they gave me a prescription. I didn't fill it, and I just ignored it. And then after a few months, it was just getting worse and worse and worse, and I started losing a lot of weight. That started scaring me, and I started getting really lethargic and pale and exhausted and fatigued and irritable. And then I was like, okay, I better start taking this medication. So I started taking the medication. It started to help a little bit at first, but mostly um, mesalamine, and there's lots of over-the-counter names for the drug, but it's pretty much just like aspirin for the intestines, because this is an inflammatory disease. And they don't really, as far as allopathic medicine goes, they're not very good at treating inflammation. It's either corticosteroids, well, that's primarily what they like to give, or something that just masks the symptoms of the pain. Um, and so I would take that, and I live in Australia now, but I'm originally American. I was living in America then, and obviously there's no universal healthcare there. So I would have to pay for the drug, and that was costing quite a bit of money. I even started buying it from Canada and having it shipped over the border so it would be cheaper. And at that same time, my brother was suffering with cancer. He had a rare form of cancer in the brain called medulloblastoma, and he eventually died from the cancer. And at that time, I was a farmer too, and training horses, and working really hard, baling hay, like not sleeping very much, and very angry about my brother dying, and overwhelmed with work, and then my own illness that I had. And I started searching for something to fill the void and the anger. That's when I discovered Taoism and the Tao Te Ching, and everything that was written in it kind of spoke to me as in ways that I really understood but was unable to put into words before. And that really lit a fire under and a passion. So I started reading everything I could about Taoism and Taoist classics. And then I thought, when reading one book, I thought Qigong um, was Taoism in a way. It's just something that Taoists do, is what I learned later. But I started trying to find somebody that I could learn Qigong from. So I started with martial arts, and started learning Qigong, and it really started helping. My flare-ups decreased, my health started getting better, my attitude, everything in my life was improving to the point where I didn't, well, no, I was still taking the medication, but the flare ups and everything was much, much better. Wasn't, really most of the time, everything was pretty good, except for maybe twice a year around autumn and spring, I'd start getting flare ups. Um, then I discovered that Chinese medicine was based on the same principles. And I never really gave it a thought before. I had a friend that I went to university with where I originally studied agroecology and conservation biology. And he dropped out and became a Chinese doctor. And I thought he was crazy. And now I just think it's amazing. It's the best thing in the world. And I should have done it earlier. I should have done it way back when he did. Um, anyway, I decided I'd go. A friend of mine who had his own story of miraculous healing suggested I go and see this particular Chinese doctor. His name was Henry Han. He's deceased now, but he was in Santa Barbara, California. Was an amazing herbalist. And I went and saw him, and he gave me a formula. And within 1 month, I was feeling the best I'd felt in really as long as I could remember. And I got really interested, and I started bugging the hell out of him about what is this? How do you learn this? Do you have to be Chinese? Do you have to learn it from your father, or is it like a kung fu movie of master discipleship for 20 years? And he kept encouraging me. He said, you really should go to school. I said, oh, I've got my own career. I don't want to like stop what I'm doing and change everything. And I'm pretty old at the time. I was like 26. And then as it would turn out, I did eventually go to Chinese medical school, did a 4-year degree, and with the goal in mind that I was going to heal myself completely with Chinese herbal medicine. So with the Chinese herbal medicine I was taking, I stopped taking the Western drugs. In fact, he told me, throw it out, which he was also a Western doctor, so he was allowed to say that sort of thing, even though he didn't practice Western medicine anymore. And I threw it out, and I just took Chinese medicine, did QiGong, and I've had every kind of diet you could think of. And so I experimented on myself a lot. And I was pretty much in remission, except I'd have a little flare up every once in a while. And then I'd just go heavier on the Chinese medicine at that time. And I was like, God, I still haven't cured it. This thing has to be able to be cured. I gotta figure this out. Went to China, worked in different hospitals, then found different herbal mentors that I've learned a lot from. And now I find it's actually quite easy. I healed myself of it completely. I find it's a really fascinating and interesting disease because it has almost every pathology in Chinese medicine wrapped up into it in one. And it varies from person to person. It's not always the same, but what is the same is the principles and the stages of treatment. We got to first stop the bleeding. We got to reduce the inflammation. We got to improve the gut microbiome. And then once that's done, we may need to deal with the endocrine system and nervous system, so the root cause of it, so it doesn't come back. I've also found that Qigong and Jineng Qigong in particular are very good methods for dealing with the root cause of the illness. Once things are under control, I think that is one of the best things you can do to really put it in remission for good.
And can you tell us a bit about that type of Qigong you mentioned?
Yeah, so Jineng Qigong means wisdom capabilities. In America, Lu Chan calls it Qi Lel, and wisdom healing is another. I think that's what they call it. Wisdom healing is another one that they call it in America. It was developed by Dr. Peng Ming, and Dr. Peng Ming was born in 1940 in China, and he was a sickly child. And because he was sickly, he sought out I don't know if it was his parents or somebody, sought out some healers and Taoist masters, and he started training in Kung Fu and Qigong and Taoist philosophy and all that kind of stuff. And he learned a lot of methods. Then he became a Western doctor. And he found that with Western medicine, it was just treating the symptoms. And then he also became a Chinese medicine doctor. And he was considered such a good Chinese medicine doctor that he was treating most of the political cabinet members. Of course, the Cultural Revolution came and outlawed all Chinese medicine from 66 to 76. But then when Chairman Mao died in 1976, they invited Pong Ming as well, Dr. Pong as one of the specialists in order to talk about public health and what direction we should go, including Chinese medicine, Western medicine, that sort of thing. And he had written a lot of books on Chinese medicine himself. And then in kind of a grand sense of poetic flair, a year or two after that, he burned all of his Chinese medicine books. And he said that Western medicine only treats symptoms. Chinese medicine treats the physiological imbalances in the body, puts the body back into balance. But the only thing that treats the root cause of the problem is QiGong. So then he devoted his whole life to QiGong after that. And he was the first master. So after Chairman Mao's death, there was kind of a Chinese Renaissance of Chinese culture, and Qigong fever occurred throughout the 1980s. And he was the first master to kind of teach openly and also in large groups, and in a way that he called it creating a large qi field, where more people practicing together creates a bigger sensation and better effects. So then he started creating a center, and that center outgrew itself because so many people came to see it. And then eventually it became what was called the Huasha Center. Greg Braden did a little kind of documentary about it and called it the Medicineless Hospital. And that's kind of what the Western world now knows it as. But it's called the Huasha Center. It wasn't a hospital, it was a Qigong training center, but it would have 7,000 people training at one time, all the time. And people would come from all over the country and outside the country with all sorts of incurable diseases and serious illnesses, and so a lot of people with cancer. And they would show up and say, I want to heal myself. And so Dr. Pong originally started teaching people himself. Then people that learned and stayed, they became teachers, and it kind of started growing into itself. Originally it would be 3 weeks for what eventually became level 1 of the Jinin Qigong system. And that's in essence is learning how to use the healing method to heal yourself. And then some people would stay for level 2 and then level 3. Then it turned into a 3-month teacher training program. Then it turned into a 2-year live-in teacher training. And that went on for about 9 or 10 years. And in addition to that, he developed some research centers on using Qigong for agriculture and making crops grow faster in scientific research and also in paranormal abilities. In 1998, I think it was 98, 10 years after the Tiananmen Square massacre that apparently never happened, one of the largest, the largest Qigong group at the time, there were 5 large Qigong groups. Jinin Qigong was one of the 5, but not the largest. The largest was Falun Gong, and they did a demonstration that challenged the government. And I think there was 50,000 about people there. And the Chinese government saw this as a threat because it had over 1 million members, and so did many of the other large groups. And they didn't have a fear of death because they were spiritual people. And they saw this as a real threat to government stability. So then they outlawed Falun Gong, and they outlawed many other Qigong groups. And they started, another thing is I worked in a Qigong department in Shiyuan Hospital in Beijing, which is one of the...
Sorry, so sorry there, Archie. We get a couple of glitches with the internet, but you're saying that, can you just say again what was outlawed?
Oh, okay. So what was outlawed was um, practicing qigong in large groups. So after that incident, you could only practice in groups of 100 or smaller. That went on. I think it still exists now. A lot of hospitals had qigong departments, and they started shrinking them or getting rid of them. I happened to work in Qiyuan Hospital in Beijing, which was one of the largest qigong departments. They used to have a whole building. Now it's one room in the acupuncture department, and it kind of practices in the hallways in another room, like
Yeah.
all over the hospital. So but it wasn't until, so Jineng Qigong was never officially outlawed, but in 2001, they said to Dr. Pong he had to disassociate himself with all of Jineng Qigong or go to prison. So he was in essence under house arrest in relative pretty good circumstances, much better than prison. And the government took over everything that he had. So they took over the Huasha Center. He's also building a Qigong city, and they took it into a military base. He was given his freedom 2 or 3 years ago. Now he's speaking again about developing consciousness and trying to evolve human consciousness and peace around the world.
And and to take this one step back, this is so interesting, but to take it one step back for people that don't know, the question of what is Qigong?
Oh yeah. Okay, so Qigong is a relatively modern word. It was actually created by Chairman Mao's administration. Before that, it had many different names that were similar to what Qigong is, which is Yangsheng, longevity exercises, Dao Yin, stretching, and meditation, mind work, all that kind of stuff. In the 1950s, the Chinese government was experimenting with Qigong, with medical Qigong in particular. And they even did a joint venture with the Soviet Union at the time of doing lots of studies. And that's kind of when the name Qigong caught on. Qi in Chinese is a very difficult word to translate. If you look at a Chinese dictionary, you will not see energy listed anywhere as one of the definitions. It can mean weather, it can mean air, it can mean vapor, gas. But the biggest thing is that whatever word is with it changes the meaning and context of it. Qi, in essence, is a process of change. Gong is also a process. Gong is like a skill that's acquired through a lot of dedication and a lot of work. And it may be something that's monotonous that you do over and over and over again, but by doing it over and over again, it elevates it to something that is much beyond what it was, into something great, an art, a skill. So in that sense, it's the art, the skill, a lifelong work of working with the function and processes of change in the body. And as a Chinese medicine practitioner, you know that there's many different kinds of qi depending on what we're talking about, which is like a process of liver function or these complex physiological interrelationships. In essence, it's a process. And qi also means gas and vapor and breath, and there's a lot of breath work involved with it.
Yeah, it's and so it's a really interesting thing to do, and it's like you say, there are so many different styles of qigong, and it's fundamentally and correct my terminology here, it's Chinese medicine or Chinese exercises to promote health and or martial arts ability, and some of them can be I think quite vigorous in movement. Some of them can be absolutely still whilst holding postures.
Yes, some of them can be just look like meditation, like not
Yeah,
moving at all, but there's a lot of internal work that's going on.
indeed, indeed. That is, and And in terms of the clients that you see, do you incorporate qigong for many of your clients?
In the past, I used to do a lot. In fact, I used to do medical qigong and Jineng qigong healing on almost every patient, and in combination with acupuncture and herbs. And I found, and this was actually something that a few of my mentors kind of told me that they had learned in their process of uh, growth and development and treating people, was that it's limiting. You use a lot of your time because it's so time intensive on only one patient when you could be helping a lot more people by doing it in a different way. So what I've done since then is teaching a lot of people it's like teaching them how to fish instead of fishing for them. So I did a lot of teaching after hours with group classes, and also a lot of philosophy and theory involved with that. And then I've put a lot of things online so that people can learn easily, affordably, or even free. But for most of my patients, I try to encourage them to do it, but I don't
Mm.
make them do it.
Yeah.
It takes a lot of self-discipline and a lot of work, and a lot of people just aren't interested in doing that. They want to feel better, but they don't want to do it to that extent.
Yeah, and having practiced qigong myself, one of the interesting things, the first thing that I came across with it was, once I'd started acupuncture anyway, was that qigong was taught as part of our studies, and for the reason being to prevent practitioners burning themselves out.
Yeah.
It already comes with that. Um, you know, this is how you look after yourself in a busy world, and so just that one small comment about it kind of really stands out to me that I'd already touched on it before. This is really fascinating stuff, and so having had that personal experience, it then provides great empathy for people that come and try to tell you about their symptoms. Be talking to someone who's actually experienced it themselves and can really understand.
And it's interesting as well that Beijing University teaches level 2 Jineng Qigong as part of the curriculum for all of the doctors or students becoming doctors there. And I think that has actually
Mm.
become the official Qigong for the whole country,
Yeah, yeah,
for
yeah.
doctors.
Wow. Yeah, and like I say, going back to the IBS and autoimmune type
Yeah.
things, for your clients to be able to talk to a practitioner who's experienced it themselves, it's a greater relief because they know you understand them.
Yes, that's it. A lot of people contact me um, because I have gone through it, and I can explain to them exactly what I went through and what to expect with the treatment. That's not a quick fix. That they got to commit
Hmm.
to
Mm.
probably minimum 6 months of treatment,
Yep,
but
yep.
they'll start feeling better within a month usually. Some cases
Yes.
are harder than others, of course.
Yeah, yeah. And do you find that sometimes that they've struggled to get help in other ways, or because sometimes these conditions can be very difficult to recognize in the first place. So again, having the relief of not having to convince someone
Most people with autoimmune disorders,
can be
they've seen
uh,
every specialist they can think of, and they've tried every kind
yeah.
of alternative therapy they can find, and they've spent a lot of money, and a lot of them are really jaded and
Mm.
skeptical,
Yeah.
um, which I totally get. I was in the same boat. I understand exactly where you're at, and I just am very honest with them. I said, "This is what we need to do, and if we don't get certain results by a certain time, then it's time to move on to someone else." But in 90% of the cases, they
Yeah. Yeah.
get a lot of improvement.
Well, it's been really interesting talking to you. And so, like I say, you're located in Byron Bay, Australia. Is there anything else that you would like to add before we finish?
I'm sorry to cut out a little bit there.
I'm so sorry. So you're based down in Byron Bay, Australia. It's been great talking to you today. Is there anything you'd like to add before we finish, or just explain to us a bit more about where you are? And obviously, I'm putting some links in.
Yep. So
with the video about
people
how
can
to
find
contact.
me at my website, which is www.alchemywellnesscenter.com.au. Also have a YouTube channel, which is called Alchemy Wellness TV and Jineng Qigong. And Jineng Qigong is spelled Zhineng, and then a new word QiGong. It's a difficult spelling, but that's the way I decided to pronounce Chinese. um, yeah. Also have a lot of free Qigong videos for people to watch on my website, as well as some audio guided practices they can download and practice at home. And most of that is the best way to start, and maybe all you really need for healing yourself with Qigong.
Well, that's great. I really appreciate your time today. Interestingly, some of my clients have relatives in Byron Bay, so you may
Ah,
be getting a few phone calls.
wonderful.
Uh, and yeah, it's been a great pleasure talking to you. So
All
thank you very much.
right.